Good afternoon and evening, everyone. Thanks for joining the Thyroid Dysfunction, Uncover the Underlying Cause with Dr. Melina Roberts. Dr. Roberts is an avid lecturer, published author, and leading authority in European biological medicine. She employs a biological approach to identifying and removing stress from the body while testing and treating organs in a unique and very specific manner, allowing all the systems of the body to function optimally. Impaired thyroid function has a direct impact on the body's ability to regulate, and healing the thyroid with biological medicine and functional medicine is essential in order to restore higher levels of health. In her practice, she incorporates the most innovative technology to treat chronic disease, women's health issues, hormonal balancing, pediatric health, digestive disorders, and cancer. Tonight, she will share her wisdom and experience on how to effectively address thyroid function for optimal health. And with that said, Dr. Roberts, let me just turn this platform over to you.
Awesome. Thank you so much, Heather. I want to start by just saying that I kind of came across treating the thyroid sort of accidentally. I was mainly under the impression that thyroid was difficult and complicated to treat and balance, so I'd leave that for other clinicians to specialize in. In my practice, I work with patients to heal their gut, improve their liver function, boost their adrenals. And then I was having patients coming back to me and saying that their thyroid was better, that their thyroid symptoms had improved, that they were able to reduce their thyroid medication. And some people were fully coming off of their thyroid medication. So, you know, I thought these results were great side effects to what I was doing. Then I'd have patients who specifically ask me to help them with their thyroid conditions, and this led me to studying this topic in greater detail. And now I understand the connection a lot more about what I was doing and how I could help the thyroid to function better when I was addressing some of the root causes. And that's what I'm hoping that you guys will gain from this talk, a change in your perspective, that the body can truly heal itself if we set up the right environment for it to do so. So thank you so much for joining me here. I appreciate you guys being here. I know all of you have really busy schedules, so thanks for joining me for this webinar. So I want to start with my little bio here, and this is that I graduated from the University of Waterloo. I attended CCNM, so I've actually now been practicing for 14 years now, so time flies. I did some postgraduate work with the Paracelsus Clinic in Switzerland, and it's where I really learned about European biological medicine. And that tends to be the focus of how I practice. I always practice with the focus more in terms of the approach, which is biological medicine. I'm the clinical director at Advanced Naturopathic Medical Center in Calgary, and I've also written a book about building a healthy child, how to really build their microbiome right from the beginning so that we can try to prevent childhood illnesses as well as improve long-term health. So that's a little bit about me. So let's get into this, because this is a pretty big topic, and you know, I think that this is a topic that really affects a number of us, because I think that we've sort of been led to believe that thyroid dysfunction happens in isolation. We think it's a hormonal problem, it's an endocrine problem. And what I want you to understand is I want you to understand the connection of thyroid dysfunction to different systems in the body and how thyroid influences those different systems. Because really, how many of you have patients who experience cold hands, cold feet, hair loss, fatigue, weight gain, constipation? Sounds like pretty common stuff that we see, right? So according to the Thyroid Foundation of Canada, there's 200 million people in the world that have some sort of thyroid disease. In Canada, the statistics are 1 in 10, and about half of them are undiagnosed. So these numbers are really high, and I think what that tells me is that we have an opportunity here. We have an opportunity to impact so many people's lives if we can just take a step back, look at the big picture and really work on uncovering the underlying cause of thyroid dysfunction. Because I think if we treat the underlying cause of thyroid conditions, we can really possibly resolve thyroid dysfunction. So, in doing what I've done, I've been able to see people come off their thyroid medications. I've seen people that have low thyroid symptoms, and I've been able to see them resolve, so the hair loss, the fatigue, the stabilized weight. So I'm going to take you back to high school biology. Do you remember in high school biology when you learned about biochemical reactions, and we learned about what do we need in order for a biochemical reaction to take place? So what we needed is we needed substrates. So that's those nutrients that we need. And we needed the right pH. So I call that terrain. We also needed it to be the right temperature. And this is where the thyroid comes in, because the thyroid, everything needs to be happening at a certain temperature in order for reactions to go through to completion. And then we also need enzymes to help speed up that reaction. So every biochemical reaction in every cell of the body needs to be at a certain temperature in order to go through to completion. So this is the role that the thyroid plays. It sets up the temperature in the body. So the thyroid, just a little description, is a butterfly-shaped gland. It's located on the lower part of the neck. It produces thyroid hormone. It's our body's metabolic regulator. It helps us to maintain that steady body temperature, and every cell, organ, muscle in the body really depends on us having adequate amounts of thyroid hormones in order for it to function properly. So here's a little flow chart of how this thyroid, these thyroid hormones go through and are released. So it really all starts with the hypothalamus, and it's this negative feedback loop. So the hypothalamus, what it's doing is it's monitoring the amount of thyroid hormone in the bloodstream. And when the levels are low, then it releases a hormone called thyroid-releasing hormone. And this tells the pituitary to release thyroid-releasing hormone. So that's your TSH. And then the TSH stimulates the thyroid gland to release thyroxine, which is your T4. And your T4 is kind of considered your storage form of thyroid. And the T4 is produced in our peripheral tissues and different organs such as the liver, the kidneys, the digestive tract. Then T4 is considered your inactive form of thyroid hormone. And then T4 needs to be converted into T3, and T3 is the active form of thyroid hormone. And when that's converted, then that's what actually drives the function of the thyroid. Now, if the temperature is too low, and when this happens, then we start to see a number of symptoms because we start to see the metabolism actually slow down. And some of the signs and symptoms are listed here. So the cold hands, cold feet, the weight gain, the fatigue, the low libido, the PMS, the dry skin, the brittle nails. One of the things that you'll also be looking for, because patients don't normally tell you, but the outer 1/3 of their eyebrow, they don't have any hair growth there. So that's something that you want to look for on patients. But these are all symptoms I see quite frequently in my practice, and when you're looking out for them, I'm sure you guys see them as well. Now, there's also the signs of an overactive thyroid. And this is when the temperature is just slightly high, and what happens is that it speeds up the metabolism of the body. Now, I'll often hear from my patients, oh, I'd rather be hyperthyroid than hypothyroid and be losing weight instead of gaining weight. But this weight loss really isn't a good thing because when you're having the weight loss, have the breakdown of tissues, but it can also have the breakdown of muscles, breakdown of organs, and so it's not really ideal to even have that overactive thyroid either. And some of these symptoms that you'll see with an overactive thyroid can sometimes be confused with mental health issues, because you'll get the anxiety, the panic attacks, the hyperactivity, the fast heartbeat, nervousness, palpitations. So really paying attention to these and being able to decipher these overactive thyroid symptoms from mental health issues. So a conventional approach is that they start with doing some blood work, and the blood work for the thyroid hormones is they check for the TSH. And the TSH reference range should be around that 0.5 to 4, and if you can see, that's a pretty wide range. And basically, if the TSH is more than 4, then that's considered hypothyroidism, and typically they'd be prescribed some sort of synthetic T4 like Synthroid. And if it's less than 0.5, then that's considered that hyperthyroidism. And the TSH is really that negative feedback loop. So if it's high, it means that what we're seeing in the bloodstream is low amounts of T4, and so we'll be signaling the hypothalamus to produce more of this TSH. And then if the TSH is low, that means that there's high amounts of the T4 in the bloodstream, and so then you're not needing the hypothalamus and pituitary to produce any of those signaling hormones. So really, if we're going by the conventional approach, we can just end my lecture right there. That's all you need to know about the thyroid. But I'm sure you guys have figured out that there's more to this thyroid story, because one of the big challenges is that, and these are a couple things that I see really I see quite a bit in my practice. So you'll have the patient who has the low thyroid symptoms, but when I send them to their doctors, they'll say that their blood work is normal. So to me, that's telling me, first of all, that likely we didn't do a comprehensive analysis of the thyroid. Then we'll have another challenge is that you'll have the patients who are currently taking thyroid medication. Their blood work is normal, but the patient still has those same low thyroid symptoms. So this tells me that, you know, likely they're taking those thyroid hormones. Those thyroid hormones are manipulating that biochemistry, because there's now, they're flooding the system with that synthetic T4. There's lots of T4 in circulation, so then the TSH will actually be moved into that normal range. And so according to that blood work that just evaluates TSH, their thyroid is now fine. But just because you have that TSH in normal range and the T4 in normal range doesn't necessarily mean that that T4 is being converted to your T3. So I call this treating the blood work, but not necessarily treating the patient. So these are challenges for sure. And as naturopaths, we know that there's this thing called a health continuum, where we have optimal health on one side and pathology and disease on the other. And then there's this huge section in the middle with clinical symptoms and functional imbalances. And what I always say is that dysfunction over time leads to disease. But what we want to try to do is we want to try to catch people in that dysfunction stage and try to push them towards optimal health instead of, and really away from disease and pathology. And there's something called subclinical hypothyroidism, which is pretty common in the literature. And the subclinical means that they have all the symptoms of hypothyroidism, so all of those low metabolism signs, but their blood work is all showing normal, so it's called subclinical. So my daughter's right now in the 5th grade, and she's learning about electricity. And one of the projects she recently had to do was making this simple circuit. So the simple circuit has a battery, a switch, and a light bulb. And so as I was preparing this talk, I thought that that simple circuit is actually a great way to explain the function of the thyroid. So first of all, you have your supply, so your battery. And the supply is the blood work. So this is what we need in order to drive this reaction. And then the T4 being converted to T3 is your switch. So if you're not able to do that conversion, then that switch will stay off. And if you're able to do that conversion, then the switch is on. And when the switch is on, that's when you'll see the expression. That's when you'll see the light bulb go off. And the light bulb is the body temperature. So these are 3 things that we want to be examining to figure out if we have the thyroid functioning properly. So I thought that was a great way to put what she's learning into what I'm teaching. So the comprehensive blood work, I think that this is really important for us to run in terms of thyroid dysfunction. And one of them is that we want to run the TSH for sure. The thing is that as naturopaths, as naturopathic doctors, we tend to see that reference range is quite large, and we want it to be smaller. So ideally, we want that TSH to be between 1 and 1.5. Closer to that range would be more ideal. And then what we want to look at is we want to look at free T3 and free T4. And this is the free ones, as opposed to the totals, tell us the actual available thyroid hormone that's circulating in the bloodstream. So what we'll see is that if you have a low TSH and a high T4, that will typically be more of a hyperthyroidism. And when we have a high TSH and a low T3, this would be more of a hypothyroidism. But what we want to do is we want to make sure that mainly we're looking at that those free T4 and free T3 in the blood. And we also want to look at them. You'll see that there's a big reference range. So you actually want to be in both of those. You want to be in the upper half of that reference range. Another thing that you want to look at is that's typically not looked at in the conventional system is a reverse T3. Now, the reverse T3 is an inactive form of T3. What it is it's actually like the mirror image of T3. So it actually fits in the receptors and blocks those receptors. So when you have a high amount of this reverse T3, you can actually have a person who's suffering from more of that hypothyroidism. So that's really important, and the reverse T3 will typically happen when the body is under stress. And that's something that you also want to look further into. We want to figure out what kind of stress the body is under. Now, we also typically MDs don't run the antibodies, but I think it's really important to check the thyroid antibodies. The reason they don't run it is because it really doesn't change the way that they'll treat thyroid conditions. But from a naturopathic point of view or a functional medicine point of view, we want to know if we're dealing with an autoimmune picture because it will affect how we treat. And I always ask for copies of patients' blood work because they may be told by their GP or their endocrinologist that all their thyroid tests are normal. But because we look at these reference ranges slightly differently, and because I want to make sure that we're looking at free T4 and free T3 as opposed to a total T4 and total T3, I like to actually see copies of them if I'm not running them myself. Now, in terms of that switch, so there's an enzyme that helps to convert the T4 to so the inactive T4 to the active T3. And this conversion happens in different organs in the body, like the kidneys, the brain, the liver. And it needs certain nutrients in order for this enzyme to work, enzyme system to work. So it needs iodine, zinc, selenium, B6, and B12. And then there's certain things that can be in the body that can be inhibiting this proper conversion. So it can stop that switch from being turned on. So first of all, if we're deficient in any of those nutrients, it can also stop that conversion from properly happening. Some of the medications that can be inhibiting this conversion can be the birth control pill, taking estrogen, beta blockers, chemotherapy agents, lithium, and any of those things can be causing that conversion problem. Stress, so high amounts of cortisol, will also inhibit that conversion. And another thing that's been shown to inhibit is a heavy metal called cadmium. And cadmium is very common in cigarette smoke. So these are different things that can be in the body that can be inhibiting that conversion. And when we inhibit that conversion, it means that that switch can't be turned on. So I think it's also important to know that there's a number of conditions that are associated with this underactive or underfunctioning thyroid. And we see this all in the conventional literature. We see a number of things showing a number of conditions that show up. So if you're seeing patients with any of these conditions, then you want to think about the thyroid and really think about ruling that out as a contributing factor to any of their health concerns. So when you're seeing like panic disorders or anxiety, obesity, sexual dysfunction, if you're seeing headaches and migraines, carpal tunnel syndrome, IBS, insomnia, hearing loss, depression. So a number of things can be going on. So you want to be able to understand that there's a connection and be able to rule out that it's not thyroid that's causing these symptoms. Now, the challenge with the thyroid blood work is that the thyroid hormones, they work in every cell in the body. They work inside the cell. But the blood work, the blood test that you do, what they're doing is they're measuring the circulating thyroid hormones that happen outside of the cells. So that makes lab tests not completely sensitive, and there's really no lab test that can tell us what the thyroid hormone is doing at a cellular level. So this is important to note that there are drawbacks to even doing the blood work. Now, how do we know if the thyroid, we have supply, we have the switch, but how do we know that the thyroid is actually working? And the way that we can know if the thyroid's even functioning is to check the basal body temperature. So this is the light bulb. This is, if the temperature is in the right spot, it tells us that the thyroid is functioning properly. And the best way for us to check the temperature is by checking the oral temperature with a liquid metal thermometer. A lot of them are mercury, and you want to check it 3 hours after waking. You want to check it every 3 hours and about 3 times in the day, and you want to do it 3 days in a row. So the one thing that you want to make sure is that for menstruating women, their temperature can go up when they're ovulating. So ideally, you want to make sure that you check that for women who are in their reproductive years, you want to check their temperature in the first 2 weeks of their cycle in order to get a better idea of what the basal body temperature is. So you want that basal body temperature to be around 36.5 to 36.8 degrees Celsius. And if it's functioning in that range, that'll tell us that the thyroid is functioning optimally. So that's one test to know that people can be doing at home to see if it's actually working well. Now, in terms of thyroid support, there are some great remedies for that, And one of them is BioThy, and it has the nutrient support that the thyroid needs. And sometimes this is something that's lacking. It's something that's not allowing the that switch to be turned on. It's not supporting that we don't have enough of that nutrient support to turn that switch on to get that conversion happening of the T4 to T3. And another remedy that really helps to support the thyroid is the lycopus. And what it helps to do is it's giving the thyroid the nutrient support and botanical support. It's cleaning, I'd say it's also cleaning up the thyroid. And the great thing about this remedy is that it can work in terms of both hypo and hyperthyroidism. So it's really dependent on, it's really helping to balance out that thyroid, so it doesn't necessarily, so the dosage will be different based on what people are experiencing, but in terms of the remedy for supporting the thyroid, it'll be the same one, because it'll help to bring that thyroid into balance. So it's a great remedy for supporting it that way. Now, there's a nutrient that that I've done a lot of reading about and studying about, and it's made me realize how important a role it plays in terms of the thyroid function. Now, the current RDA is 150 micrograms per day, and really that's an extremely low amount. It's just an amount that would prevent goiter. But what we're figuring out is that the body actually needs a lot higher amount. And really every tissue of the body needs iodine, especially the endocrine organs, so the thyroid, the adrenal glands, the breast, the prostate, the ovaries, the pituitary gland. Now, when you look at, when we're talking about T3 and T4, so those thyroid hormones, what the numbers are actually referring to is they're referring to the amount of iodine molecules in that hormone. So that's how important iodine is to the thyroid hormones functioning. And when we're seeing any sort of deficiency in iodine, we actually see an imbalance in the hormones. We start to see cyst formations. So when you're seeing fibrocystic breasts, if you're seeing ovarian cysts, uterine cysts, and then also cancers related to those endocrine organs. So ovarian cancer, and uterine cancer, and thyroid cancer are all related to that that iodine deficiency. And we've actually seen that iodine deficiency really decrease in the last 50 years. And I think there's a number of reasons for that. Some of them can be because our soils are deficient, so our crops that we're eating are deficient in iodine. It can also be because we're taking in things like bromine and chlorine through the drinking water, and fluoride through drinking water as well, and dentistry, and those are all halogens, and those halogens can actually interfere with the receptor sites for the iodine. So then we get lower levels of iodine because that we're actually using because those halogens are taking up receptor sites where iodine should be. And there's some interesting studies that show that women who have low iodine levels during pregnancy, that their offspring actually have lower levels in spelling, grammar, English literacy at age 9. So that's how important iodine is also important when you're for our pregnant women. And so in terms of those levels should actually be around, I think it's probably around 6 to 50 milligrams per day of both a combination of iodine and iodide. And the reason you need both is that different tissues utilize the different forms. So like a thyroid gland will primarily use the iodide, and then the tissue, like breast tissues, will need the iodine. And some good sources, and I think that that's more of a challenge, is that we don't have a lot of these in our diet, is the sea vegetables, and organic eggs will also have some amount of iodine in it as well. But I know that there's huge misconceptions when it comes to iodine. Now, one is that we only see iodine deficiencies in third world countries, and I think often medical doctors will say this, and they'll say this when I'm suggesting to patients that they should be taking iodine and higher amounts of iodine, and they're told that there's no chance that they are deficient. And I think one main reason is that they haven't even tested for it. Because really in our diet, most people's diet is actually deficient in those sea vegetables and the ocean fish where you get the iodine. And then we're seeing bromine, the chlorine, the fluoride in our environment that can displace that iodine. Another myth is that we get enough iodine from those iodized salts, and that's not true either. First of all, those iodized salts are low quality and they're poorly absorbed. And if you actually look at it, the iodized salt contains about 77 micrograms, and on average, people are taking in about 4 to 10 grams, and the bioavailability of that salt is about 10%, which just leaves you with 30 to 77 micrograms, and that's even below what we say the RDA. So, and what studies are showing is that we actually require between 6 to 50 sorry, I think I wrote down the wrong number there, but 60 to 50 milligrams of that iodine per day. So there's a correction. I forgot the M there, but it's definitely a lot more than the micrograms. And then taking iodine, they're often told that iodine will actually worsen their thyroid condition, and we cannot really effectively treat thyroid conditions unless we have enough iodine. So iodine plays such an important role in how that thyroid functions. Another thing about iodine is that when it's up at that upper level around that 100 times the RDA, so about 15 milligrams, we actually produce like a fat-like substance that's a key regulator to adiposis. And adiposis, what it is it's programmed cell death. So in cancer cells, they just keep proliferating, and we don't actually go through this programmed cell death. So when you take iodine at that higher level, it actually promotes adiposis, which is a key factor in helping to treat cancer. So iodine in high doses is actually very anti-cancer. So that's important to know too. So one of the tests I run quite frequently with my patients who have any sort of thyroid issues is I run the Iodine Plus test. And this test will look at iodine levels, it will look at selenium levels, it looks at bromine levels because the bromine will tend to displace the iodine. So if you have high bromine levels, sometimes that's the reason why those iodine levels are lower, because it's displacing it. And it would also check the cadmium levels. So if we have high cadmium, sometimes that can be what's disrupting the T4 to T3 conversion. And so that's something that would be interesting to know as well from this test. So we learn a lot of information from running these tests. And, you know, like I've had patients who they've shown to have a deficiency in the iodine, start taking the iodine, and, you know, I had one patient the other day who almost immediately stopped having hot flashes. So, you know, I wasn't thinking that that was the cause of her hot flashes, but that was really interesting to me that once we got the iodine in place, that helped with her whole hormone balance. And I think another thing that's important to note is that is that the TSH, sometimes that increases once you start supplementing with iodine. And the TSH, what it's doing is it's stimulating the thyroid gland to produce thyroid hormone. So it's not surprising that that would be increased, but the TSH, what it also does is it's stimulating the body's production of this iodine transport molecule, which helps to shuttle iodine from the bloodstream into the thyroid cell. And so if the TSH is increased, but you don't have any clinical symptoms of hypothyroidism like fatigue, hair loss, headache, and the T3 and T4 are normal, then it's not hypothyroidism. And so it's not inducing hypothyroidism, which sometimes people will say. And we can see that TSH increase for about 6 to 9 months after doing that. And it's important to know that taking thyroid hormones can actually make that iodine deficiency worse. Now, I want to also explore this connection between the brain and the hormonal system, because the hypothalamus and the pituitary, they play really important roles. They're basically your control centers of the hormonal system. So this is really part of the nervous system, and if the nervous system is disrupted in any way, it can really be affecting the proper function of that whole hormonal system. So some of the things that can disrupt that nervous system, one is heavy metal toxicity. So if we have high heavy metals have an affinity for the nervous system, so this can throw off that whole brain hormone connection. And another thing that can throw it off is if we're taking in calcium but not pairing it with vitamin D and vitamin K2. You know, I think that there's a pretty popular study in the British Medical Journal 2010 of women who were taking more than 500 milligrams of calcium, and what was happening is that for those women who were taking that amount of calcium, they actually had a 40% increase of MIs, so heart attacks. And the reasoning behind that was that if you're not pairing calcium with vitamin D to help absorb the calcium and vitamin K to help distribute the calcium to the bones, then we can have a lot of calcifications happening elsewhere in the body, including the heart, the arteries, and even the brain, so the hypothalamus and the pituitary. So in this case, it's actually really important for us to be taking vitamin K to make sure that we prevent and break down some of those calcifications. And there's also a great remedy called the Neurovita, and this is a drainage for the nervous system. So it helps to clean up that toxic load and move those toxins out. Another one that I use for cleaning up the nervous system is the chlorella. And the chlorella, I believe it's Biorella, and that helps to it actually can pass the blood-brain barrier, and it can help to move toxins and heavy metals out of that nervous system. So another really key factor in terms of this balance is the liver. So the liver, it's a really important organ. It's one of your body's major detoxifying organs. And what many people don't realize is that the liver is actually where all your hormones are metabolized. So the liver makes cholesterol, and cholesterol is the building block of all your hormones. So it makes the hormones for your ovaries and testes. It makes the hormones for your adrenals, so all your stress hormones. And then it also makes the hormones for your thyroid. So if that liver is congested, if that liver is not functioning well, then it can be affecting the function of the thyroid. So it makes it really important for us to be able to effectively support the thyroid. So some of the signs that the liver may be out of balance be a number of things, from digestive issues to skin issues to abdominal fat, increased abdominal fat. You can see some issues showing up in terms of the lymphatic system. And then we can also see, actual pain or discomfort over the liver. One of the common things I often see is the nausea and or the patient waking up between 1 and 3 a.m. So anytime they're waking up at 1 or 3, I can see that it may be liver congestion, or if they're experiencing some nausea, I'm thinking liver congestion. So now there's some other great remedies that what these remedies actually help to do is they help to support the phase 1, phase 2 detoxification pathways. So they give the body the proper nutrients in order to help get the liver to function better. And if we have a liver that's functioning better, then we can have a liver that's able to make hormones better. Now, another factor when we're talking about the liver cleaning up tissues is understanding that we need to be able to clean up the extracellular space. So hormones, what they are is they're actually messengers between cells. So what that tells me is that we also need to have a really clean extracellular space. So the space outside the cell needs to be free of toxins in order for the hormones to be able to properly communicate. So one of the great remedies for helping to drain that extracellular space, clean up that toxic load so that these hormones can properly communicate is the hepatica to help get the liver functioning well, the solidago to help get the kidneys functioning well, and the lymphodrop that helps to the lymphatic system to clean up all of that metabolic waste and move that out of the body. So great drainage remedies to help clean up that extracellular space, because that's where a lot of the communication happens with those hormones. So a really key factor, which I think often gets overlooked, why this hormonal system isn't working well. It's because there's stuff stuck in this extracellular space that's not being shifted out. Now, another connection with thyroid is the adrenals. Now, I think adrenal dysfunction is also something that's pretty common and pretty challenging in our world. And, I think you can look at this list and, I'm sure you guys see this a lot with your patients, the fatigue, the headaches, the constipation, the fogginess. One of them is also like the mid-abdominal spread, so that's when the cortisol levels are high. Start to see, they crash between 1 and 3 p.m. They have sleep issues. They're having weakened immune systems. So just various factors that are telling us that the adrenals are out of balance. Now, the adrenals, they're releasing stress hormones, so your body can adapt to that stress. And one of the symptoms that we often see with that low adrenal function is that they'll also have that low blood pressure. Now, what you need to understand is that the adrenals and the thyroid work really closely together. So if the adrenals aren't functioning at their best, it actually brings down the function of the thyroid. That's how closely they work together. They're like players on the same team, and they really are supporting each other. And so what's really important is that we actually have to work on healing the adrenals. And one of the ways we can do that is that we need to identify and remove stressors, and then we have to work on improving the adrenal function. And if we don't have enough adrenal hormones, this can actually contribute to a poor conversion of the T4 to T3. So one of the challenges with treating the thyroid is that we have to first correct the adrenals. So we have to treat the adrenals first, and then we have to address the thyroid. So this is actually really important. Now, we got to look at these stressors on the adrenals. So these are all things that can be draining the adrenals. So I'm going to go through 5 of those stressors. I'm going to try to go through those quickly. One of them is food sensitivities. So first of all, we could be eating foods that are causing inflammation in the body and draining the adrenals. And the other challenge with that is that if the adrenals are, or if the digestive tract is all inflamed, it also means that we're going to have difficulty absorbing the proper nutrients in order to support thyroid function. So we might not be able to properly absorb iodine and selenium and zinc and the B vitamins that we need in order to drive the proper thyroid function. So an important factor, and this is what I always do with patients, is we always have to start with healing the gut. So good probiotics, we've got to heal the lining of the digestive tract, we've got to heal the immune system. Now, we can also have immune challenges on the body. So we can have overgrowth of bacteria and fungus in the gut. This would be challenging the immune system. We can have viruses or parasites coming into the body. And when you have those coming in, those can also be causing inflammation and draining the adrenals. Another thing that can be draining the adrenals is heavy metal toxicity. So there's some key ones. Mercury binds to the thyroid gland and can disrupt its function. The cadmium can be inhibiting the proper conversion. And there's another factor as well, is that selenium itself is actually a chelator of mercury. So if we have high amounts of mercury, then that can actually lead to a deficiency in selenium. And we need selenium in order for us to have proper conversion of the T4 to T3. So sometimes the heavy metals can really be affecting this proper thyroid function. So I go through here some of the different remedies that we could be using to help move those heavy metals out. The Biorella helps to bind those heavy metals, and then the Solantrix helps to mobilize those heavy metals. And the cool thing about Solantrix is that it can pass that blood-brain barrier. Now, there's also some environmental toxins, and specifically there's these hormone-disrupting chemicals, and they can mimic hormones, they can stimulate, block, disrupt hormones, natural actions, and so we want to be avoiding these hormone-disrupting chemicals, and some of those are pesticides. There's the phthalates that you find in plastics, bisphenol A that you find in canned goods. There's some food preservatives. There's those synthetic estrogens. So all of these can actually be disrupting proper adrenal function. And some of the ways we can help to remove those is with a remedy called Luvos. I love it. It helps to sponge onto those toxins and move them out. The Biorella also works well in helping to bind and then move them out. And a fifth stressor on those adrenals is mental emotional stress. So if we have high amounts of stress, then that also can be inhibiting that proper conversion, that turning that light switch on for that thyroid to work. And the Avena works really well in terms of calming the nervous system and helping with that stress response. Now, in terms of supporting those adrenals, so once we've removed those stressors, now what we want to do is we want to help to build up those adrenals. And we can build up those adrenals with the adrenum is really good at helping to increase blood supply to the adrenals. And then there's these other remedies, the SFF, ASF, and the Super B, which actually supplies the body with the nutrients that the adrenals need in order to be able to function properly. Now, I have the conversion chart, and I think that this is really important to just be aware of, because I think a lot of my patients, they'll come in to me, they're on Synthroid, and my first step is actually recommending to them that they ask their doctor to switch them on to a desiccated thyroid hormone. And the desiccated thyroid hormone, it's from a natural source, and it actually contains T4, T3, and then it also contains a little bit of T2 and T1 and some selenium as well. So whereas the Synthroid just has synthetic T4 in it. And so this helps to just convert. This helps, you know, if they're like, well, I'm taking this dose of Synthroid, then they'll be asking their medical doctor for the desiccated thyroid hormone. And what I found from my experience is that if patients aren't actually, if they don't demand it, then they won't really get it. So they have to go in and be like, can you please switch me to this desiccated thyroid hormone? Because most medical doctors are sort of trained that there's no therapeutic advantage to taking the desiccated thyroid hormone. So they'll much prefer doing the Synthroid over the desiccated. It's really important to also know that if someone has an iodine deficiency, that if they're on a thyroid hormone, it can actually make that iodine deficiency worse. So that's why it's really important to check for iodine. So my approach with treating thyroid is first I want to do the comprehensive thyroid blood work. You want to check their basal body temperature. You also want to know their clinical symptoms because, you know, we're treating people here. We're not just treating blood work. We're not just treating temperatures, right? We want to actually be talking to patients, right? So we're not just treating symptoms. And so we want to actually listen to the patient and find out what those clinical symptoms are. I also like to run that Iodine Plus test with patients when I'm looking at those thyroid conditions. And then where I'm going to start is I'm going to start with healing the gut. And when we heal the gut, we allow the body to be able to absorb those nutrients and minerals that they need to run the thyroid. And it also helps to decrease that inflammation and help to take a stressor off of the adrenals. We want to drain the toxins from the extracellular space. So you want to help to clean up that extracellular space so that those hormones can actually communicate with themselves. You want to help to support the liver so that the liver is able to make hormones. Then we want to support the adrenals, and then we do thyroid support. So it's definitely a process in terms of treating the thyroid, but if you do all of this, if you follow this, then we can actually start to see patients improve from thyroid conditions, and it's possible. That's the really cool thing. If we treat that underlying cause, we can actually resolve thyroid issues, and I think that's an awesome thing. So thank you so much for listening. Thank you so much for your time, and I apologize. I believe I went over time. We're pretty active on Facebook. We're active on Instagram, so those are the pages to get there. If you have any questions or comments for me, please send me off an email, and I want to thank Heather and the whole Biomed team for inviting me to speak. So thanks you so much for having me.
Great. Thank you so much, Dr. Roberts. That was a great and very comprehensive thyroid dysfunction and function overview. I hope everybody has been able to take some information away that's going to be very helpful for incorporating it into your own practices. And so a few things. I would like to invite anybody who's got questions, please type them into the Q&A section, and I'll start going through them in just a moment. And Dr. Roberts then will be able to answer them to the best of her knowledge. Okay, so the first question is, you answered it within the context of your presentation. The question is, what is the name of the RMA lab that you run your thyroid tests? For, I guess she said iodine, selenium, bromium, and cadmium tests?
So yes, it's the Iodine Plus test with RMA, and yes, it covers iodine levels, selenium, bromine, and cadmium. So it covers a lot, so it gives a lot of information about what's going on potentially with that thyroid. Perfect.
Okay, and so I've got 2 questions here from Sarah. So the first question is, can you comment on the formulation of desiccated thyroid? She was advised by an endocrinologist that desiccated is measured out by weight, not necessarily by composition. Would this pose an issue for consistency?
So I think that, and I think that that's what, the medical doctors are taught in school, that the desiccated thyroid hormone just isn't as reliable because it is coming from a natural source as opposed to like the synthetic sources where they can really monitor the quantities and amounts. I think if you look at that conversion chart that I have on just the the second last page, that can be really helpful. And I do think that you need, or sorry, the third last page there, is that you also need to monitor and make sure that you're monitoring the blood work, so you're making sure that it's staying consistent. And you also want to see, okay, I have them on this desiccated thyroid hormone. Is their body temperature now improving? Is it now moving into that normal range? Because that's how we'll know, is it actually having an effect on the body? And for a lot of people it does, because it has that T4, because it has that T3 in it, which the Synthroid doesn't. And I think that if you're monitoring that, and I would say monitor that like every 3 months. If you're monitoring that, then you'll be able to know if that desiccated thyroid hormone is working better for your patient. And I also think you have to do all the other work too. But I think that that's probably the challenge that most of them have, is that there is potential that because it's from a natural source, that it's that the potency can be not as reliable. But I think as you're monitoring it, you'll be able to see if that's actually working better for your patient. Does that help? Right. Does that answer it at all?
I'll see if Sarah gives some feedback on that. She had a second question as well. If somebody has been on a long-term thyroid replacement therapy with Synthroid, is there a possibility that you can get off of Synthroid?
So it is possible, but for sure it's harder work. It's more challenging, because the thing is that the longer that you're on the Synthroid, one thing is that it kind of makes that thyroid gland a little bit lazier, because if there's already T4 there, then that thyroid gland doesn't have to do very much work. And if that's happening over a long period of time, like someone's has been on that Synthroid for 10 years, that's 10 years that thyroid hasn't had to work that hard. And so that's why I suggest, first of all, switching them onto the desiccated while you do all of the, while you treat all of those underlying causes. With the desiccated thyroid hormone, it does make the thyroid do a little bit more work. So, so you can see a little bit more of that shift. I think it's possible. It's just, it takes more work.
All right. So next question. Would you recommend taking iodine if one has previously had thyroid cancer and no longer has a thyroid gland?
So I think it's a good question. I think that because every tissue in the body actually needs iodine, not just the thyroid, not just the thyroid gland. Every tissue in the body needs that mineral to function. So I think that first of all, you want to check and see what your levels are at, and then if you do see that they're low, I think that you would benefit from taking that iodine. And again, I would always just start low and then work your way up if they're doing okay. Because the challenge with iodine is that what can happen is that as you start to take iodine, what can happen is that you actually start to remove some of that bromine from those receptor sites. And as you start to remove those bromine or detox that bromine, you have a bit of a detox reaction, which can look like a rash or can look like an allergy picture. So often people will say, oh, well, I'm allergic to iodine, but that's really not the case. It's just that you're actually detoxing the bromine. So that's also important to note as well, and so that's why I normally start at lower doses of iodine and kind of work my way up. But yes, I think that it still would be beneficial if those levels are low.
All right. There's still quite a few questions here, so lots of questions. I hope you have lots. Okay, the next question. What are your comments about the consumption of gluten and thyroid health from the autoimmune perspective?
So I think that gluten is a major inflammatory food. So the challenge with it is that it's going to, anytime you consume it, it's going to inflame the mucous membranes of the digestive tract. And so you're going to have more inflammation in the body. It's going to be draining the adrenals. When the adrenals are drained, that's going to bring down the thyroid function. When you have more inflammation, it leaves you more susceptible to autoimmune pictures. So I think that gluten and definitely wheat would be removed from the diet in any thyroid disorder. I always take wheat out of the diet for anyone who's trying to obtain optimal health.
All right.
Did that answer your question?
I think so.
Okay.
I say that because I have to stream through the questions to see about answers. Okay, so yes, I did get a thank you on the synthroid and desiccated question. So yes, you definitely did answer that. Okay. How are you assessing heavy metals, with hair or urine, or how are you doing it?
Yeah, so I do a provoked urine analysis. So I'm giving a patient a chelating agent. Typically I do it via IV, but I sometimes will also do it orally. And then, so chelating agent, so it's provoked, then collecting their urine for 6 hours, mailing that off to the lab. I do use RMA for that as well, giving a big boost to RMA. And then they send us back the report and give us an analysis of the heavy metal content. So for me, the provoked heavy metal test is how I'm checking for if heavy metals are an issue for patients.
All right. Okay, so here's a question about basal body temperature. Why measure basal body temperature 3 hours after waking rather than at the time of waking?
Yeah, I know. So when we had originally learned about basal body temperature, I remember being told to check it, first thing in the morning before you do anything. But then what I've learned along the way is that we actually want to just get it for thyroid function, as opposed to fertility. We want to kind of get an idea of what the body is generally operating at. And so that means that can be you like active throughout the day and doing things. What is your body in general operating at? So that's why you want to do it You want to do it after waking, and you want to do it throughout the day, because you want to kind of get a general idea of as I'm functioning throughout the day, what's my body temperature operating at.
All right, that's a good question. I mean, a good answer, good explanation. Okay. So next question, what is the reverse T3?
So reverse T3 is, it's a T3 that's actually made when we have stress. So your body will normally be making, so T4 into the active form of T3, but when your body is in a stress situation, so high stress, potentially high stress in the body, if there's infections, even heavy metals, that would be considered high stress mentally, emotionally, then what can happen is that your body can make that T4 into this reverse T3. And the reverse T3 is just a mirror image of your T3, but it's similar enough that it fits in that same receptor site that T3 does, and it's inactive. So it actually takes up that receptor site, but isn't active. So what can happen is that it can actually create this hypothyroid picture. So what they actually show is that we I think, I forget the numbers exactly, but we do naturally produce reverse T3. I think it's at like 20%, but when it's more than 50%, that's when it becomes more problematic. So that's when you want to know what are those numbers. Like at a lower number, that's no problem. It's normal for the body to do that, but when it's in higher levels, that's when it becomes more problematic.
All right. So we've still got a few more questions here. This is a question about a swimmer. So if you have a 14-year-old who's swimming 2 to 3 hours a day in a chlorinated pool, what kind of support should be given to help counteract the negative effects of chlorine? This 14-year-old is experiencing lots of skin issues like acne and itching and digestive issues.
So there are ways that we can help to sponge up that chlorine, but for sure this is it's a challenge to me because I like patients to be active, and I think swimming is a great activity to be doing, but for sure that chlorine can be affecting the proper function of that thyroid by being a halogen and taking up some of those receptor sites. Some of the ways that we can kind of sponge that chlorine and help to move that chlorine out of the body would be like the Luvos would help with that, and chlorella would also, so the Biorella, those two would help to clean it up. But it does sound like they also have some, the patient does also have some digestive issues, so healing the gut, taking them off of those inflammatory foods. When stuff is showing up on the skin, usually tells me that your organs of detoxification aren't working at their best. So this patient, you also probably want to work on improving their liver function too. So those are, just some suggestions based on like just a little bit of what you told me, but of course you want to do a full assessment before you before we start treating the patient, right?
Exactly. Okay, so this is another question from the same person. How about taking iodine with somebody with thyroid nodules that are non-cancerous, as there's lots of controversy as if it can increase antibodies or not?
Yeah, and again, what I think we first have to do is you have to check and see if their iodine levels are low. If they are low, again, I would just start low, and yeah, I'm not too concerned with it causing problems, because remember, like every tissue needs that iodine to function, and yeah, when you're looking at those nodules, normally the nodules, the reason they're having symptoms is more because there's inflammation happening in those nodules. So you need to also address that inflammation. So, taking these different thyroid remedies will help, like the lycopus would help to clean up that inflammation around that thyroid, and help to clean up that environment, and then iodine could actually be useful to those tissues. But I'm not concerned with iodine, that iodine would cause any or worsen any sort of autoimmune picture.
All right, thank you. Okay, so then, sorry, in that answer, did you also address about taking iodine with somebody with Hashimoto's?
Yeah. So I said we want to decrease the inflammation, and yeah, I'm not concerned with the taking that iodine would make the autoimmune picture worse, especially if they're already showing low amounts of it. So, okay. And again, you want to test for it, and you want to start low, and then move up.
Perfect. Thanks for that clarification. Okay, so you got some good big thank yous there. Okay, so we've got in the Q&A section, I've got 2 more questions, and then I've got a few in the chat room as well. Okay, so can you take BioThy while on Synthroid?
Yes, so I'd say the only challenge would be that there's some of those proteins in it, so I would say that you want to be careful with it, taking the BioThy with an autoimmune picture, and just stick to the minerals that are needed, and or stick to the lycopus in terms of cleaning up and supporting and improving blood flow to the thyroid. Sorry, I'm losing my train of thought. What was the question again? What else am I answering?
I think that's part of it. Okay, one more question here, and then I'll flip over to the chat room. So, okay. Is it possible to have low thyroid symptoms and also deal with weight loss?
Yeah, I think that what can happen quite frequently is that people actually, because when I talk about, when we talk about temperature, it's very slight. It's not like you're having these huge jumps. It's like, slightly high and then slightly low. And so often people will actually kind of jump between high and low. So they may have some of those low symptoms, and then it might jump high for a period of time, like they might sleep high, right? So, yes, it is definitely possible to kind of jump between hypo and hyperthyroid symptoms, just because, yeah, when you're talking about that temperature, it's finite. It's very small intervals of change. It's not these huge jumps, and that's why checking your temperature with just a digital thermometer typically isn't sensitive enough. that's why you want to check your basal body temperature with one of those liquid metal thermometers, because it's just more sensitive to those small changes in temperature.
All right. And actually, when you get the liquid metal thermometers, they're not so easy to find nowadays, especially the ones that are mercury. The mercury thermometers, they're almost next to impossible to find, of course, because of...
Yeah, so that's why I said liquid metal, because I think they don't have the mercury ones anymore, but they do have, like, some other metal.
Yeah, they do have a liquid metal ones. I'm sure that probably there's some places that you could still find mercury thermometers if you looked hard enough. So. Okay, so I've got a few more questions here for you, and so we'll just take a couple more minutes to get these answered. For patients that do not eat pork due to religious reasons, do you have some suggestions other than desiccated thyroid or biothy or anything with pork in it?
Yeah. So I think, and is that just pork, or is that like vegetarians? Because I think they also have a desiccated thyroid hormone that is bovine, so as opposed to the pig-based.
Mm-hmm.
So that
they're
may
actually,
be an option.
You're right, there is bovine-based ones. What I've heard is that the porcine-based ones are closer to human
for
thyroid.
Sure they would be. Yeah.
But you're correct, though, for sure there is bovine-based ones as well. So I think this was a religious question opposed to a vegetarian question.
Okay. So, yeah, there is that option. Again, I'm not sure how easy it is to get a hold of those. I know it's even just tough to get the desiccated thyroid hormones. But I think that, you know, like for me, I think that when I see that, like I think that we start to see it's easier to make that shift if you go from synthroid to desiccated thyroid hormone, treat the underlying cause. But I think it's possible to also treat the underlying cause while still on synthroid. I've done that with a number of patients too, because either their doctor wouldn't switch them to synthroid, you know, various reasons why they still, or some patients just, they do feel better on the synthroid, that likely their conversion is still happening, right? Their body is able to do that conversion, so synthroid actually works well for them. So I've been able to, and then I address the underlying causes, and then we slowly wean off of the synthroid, and it's possible to do it without the desiccated thyroid hormones. And then, yeah, in terms of the biothy, it would just be finding that, just taking the minerals that they need to support the thyroid in that conversion.
Yes. And also probably with lycopus, increasing blood flow to the thyroid as well, which is a vegetarian option.
Yeah, for sure.
Okay, excellent. Okay, I've got another quick question here about iodine. Have you ever used Gamadine iodine?
I haven't recently, no.
Okay.
So I'm not sure if that would. Yeah, I'd be interested to try it, but I haven't been using that, no. So I can't give my opinion on it, I guess, or experience on it, because I haven't been using it.
Okay. Here's a question about the bromide detox. How long does it take for somebody to detox once they start taking iodine?
Oh, the bromine? With the bromine, it's, from my experience, I've only just seen it for like a couple days. So it hasn't been something that's ongoing, but it's, you know, like it's that they've taken that first dose and they're breaking out in a rash. And so, and contacting me saying, oh, I'm having an allergic reaction to the iodine. So, but if they continue to take it, that reaction, it will clear within like a couple days. It's not very long.
Okay, perfect. That's good for people to know. That's actually an extremely good clinical pearl because I haven't really heard people talking about this potential detox reaction that could appear to be an iodine allergy, but actually is in fact just a detox reaction. So
yeah,
I'm sure
so I think that's important to know. Yeah,
super important to know because then we can coach patients through what they're going through and let them understand that it's just temporary. Okay, last question of the night, the big one.
Okay.
Neurological Lyme. Do you find that there's the thyroid has a big part in the picture of a neurological Lyme disease picture?
So, so to be honest, I don't specialize in Lyme, so I don't see it a lot. But in terms of like these chronic infections, you know, you always have to ensure that the immune system is strong. I think that's what often people aren't really talking about. They're all about trying to kill off an infection. But when you have these chronic infections, you got to make sure that the body has a strong enough immune system to be able to fight off these infections. And when we talk about immune system, about 80% of the immune system is housed in the gut. So again, you're starting with the gut. Then you're going to try to work on removing that infection. So that's I call it a stressor on the body, and then and it's a stressor that's draining those adrenals. So you got to remove heal the gut, improve the immune system, work on working on removing that infection. And I know it's a challenging infection to move, and I think because it tends to move intracellular. But I think that as you do that and cleaning up the nervous system, you can definitely help to improve that Lyme picture. And sometimes with that Lyme picture, because it's that chronic infection, it's draining the adrenals, which is draining the thyroid, and so you start to see thyroid dysfunction happen simultaneously as well, and that's where you're improving the nervous system as well. So to me, it's that multi-causal approach, and you got to look at it as treating the root cause and treating some of those underlying causes, and you can help to really resolve that and really help patients to be able to thrive through that.
Great, thank you very much.
My long explanation.
But it's good because kind of multi-causal, but all the body, like really treating the body and coming back to the root and getting the body strong and regulating again, which of course is a lot of the principles in biological medicine. So I'm looking at it from all of those different perspectives. Yeah. Mm-hmm. All right, so that's the end, and so thank you, Dr. Roberts, for a wonderful presentation tonight about getting to the underlying cause of thyroid dysfunction, and of course, thank you for answering all those questions. There was so many of them, so we had lots of people on tonight, and it just shows that there's so much interest in learning how to really truly affect the thyroid in a positive and healthy way. So behalf of Biomed and behalf of myself, thank you for sharing your wisdom and your clinical experience with everybody tonight. It's been a really wonderful webinar. Awesome. Thank you so much for having me. You are welcome. Thank you, everyone, for being here. Thank you so much, and have a really wonderful evening.